And joining us now, Dr. Arlene King. She's the Chief Medical Officer of Health for the province of Ontario, and thanks for coming in to be with us tonight.
You're welcome.
Well, we've just heard in our previous discussion some criticism about the fact that some believe the province of Ontario wasn't ready for what's gone down. What do you think?
Well, Ontario has been preparing for quite some time for this event, as has the rest of the country. The pandemic plan that we have was put in place in 2005, and there were all aspects of a well-rounded pandemic plan considered, and the plan received a lot of accolades internationally and nationally for how comprehensive it was. And you know, pandemics are events that you can't plan for exactly and precisely,
Sort of,
they're going to be...
You know when they're coming.
Well, we don't know when they're coming. I mean, pandemics come about 3 times a century, and...
but you know when you want to prepare for it. And
we do.
You did know that you wanted to prepare for this one, and you wanted to roll out a massive vaccination program. 13 million people in the province. How many have been vaccinated so far?
Well, we've rolled out about 2.2 million doses of vaccine, and we are still getting information on how many people have actually been immunized with that, but our goal is by the end of the week that we will have all of that vaccine out of fridges and in people's arms.
Of how many people?
We have 2.2 million doses out there.
So not that many people have actually had it yet.
Well, we're going to get that data next week. I mean, the data is still coming in terms of how many people have been immunized.
Okay. Are you where you expected to be at this stage?
Well, I think we're progressing really rapidly and really well. We're expanding all of our delivery sites for our immunization program. So we now have about 111 clinics that are in place right now administering vaccine on a weekly basis, and about 2,800 other delivery sites. So that would include hospitals and primary care physicians and family health teams, those kinds of sites where we can optimally reach the people we want to reach right now, which are the priority groups that I've been talking about repetitively.
Why isn't the vaccine fully available at this stage?
Well, it's really supply dependent, and we've been receiving up till now about 722 doses per week. This past week, we've received considerably less.
So is it the manufacturer's fault?
Well, you know, there have been some production difficulties. That's the explanation that we've received, partially for why the amount of vaccine that we received this week was less than what we anticipated, which has obviously made us sort of rethink how quickly we can roll out our immunization strategy. But you know, we're managing with the amount we've gotten, and we're rolling out our program as quickly as we can.
No, I hear you. I'm just, you know, we see these sort of conflicting stories about obviously people in Toronto lining up around the block for 5 hours to get a shot, whereas in Sault Ste. Marie or in Brantford, they apparently did something different because they're way ahead of the game, way ahead of everybody else. Why such a disparity? Well,
there's certainly variability in terms of delivery methods, and there are different numbers of priority groups to populations in each of those various areas of the province, and every health unit is determining how they can best reach the population that they have in their areas. Now, that being said, we advanced our program by a week as well. And of course, there was really unprecedented demand in that first week, I think largely catalyzed by the really unfortunate and sad deaths of 2 children in the province. And that had not only an impact in the province, but across the country in terms of the demand for flu vaccine, I think particularly in the people that were possibly undecided about whether or not they wanted it. And I think that catalyzed a lot more interest than what we were able to manage in that first week.
So safe to say you weren't planning for that kind of buy-in from the public?
Well, the demand certainly was unprecedented for flu vaccine. Every year, Ontario has a universal flu program, and we immunize less than 50% of the population during that time. We'd like to see higher uptake, but this illness, and again, I think the deaths of those 2 children really catalyzed a lot more interest than what we had expected.
We did discuss earlier in the program how responsibly our other participants felt the media had been covering all of what's transpired. You pointed out 2 very tragic deaths, but lots of people die from the flu every year, and I wonder whether you think the reporting has been responsible so far.
Well, I think that there perhaps it needs to be more emphasis on the fact that this has been a milder influenza season than we even normally get with seasonal flu so far. We've had, normally we get about 300 deaths reported per year, and that's reported deaths, and that's really the tip of the iceberg of the number of flu-related deaths, and about 17,000 hospitalizations a year. And again, so far in this pandemic, we've had 37 deaths and somewhat over 600 hospitalizations.
In Ontario alone.
In Ontario alone.
It's 100
and
deaths
again,
across the country.
Not to minimize the impact, particularly on the individuals and the families, but nonetheless, it is a fairly mild impact from a population-based perspective.
In which case, have media overreacted to what's transpired?
Well, I think that they're responding to some of the concerns Canadians have. I think that, again, if there is a silver lining in all of this, is it's catalyzed a lot more interest in immunization and our influenza programs, which is very important because seasonal flu in particular has a huge toll in Ontario and across the country, and we don't know how this pandemic is going to be finishing off as well. And so it's really unknown what the future holds in terms of how this illness is going to behave.
But as you gauge the public's reaction to all of this, would you say it has been commensurate with the threat?
I think that it has, actually, by and large. I think there have been ebbs and down points in terms of public concern related to this, but I think by and large Canadians are managing this pandemic very well in a very moderate way. Most people are getting on with their lives. They're doing what we're asking them to do, staying home when they're sick, covering their coughs, and cleaning their surfaces, and getting their flu shots in record numbers, and I think they're doing exactly what they need to be doing.
Let me ask you more about the vaccine. Was it, because of the shortages, was it a mistake for the federal government to put all of its eggs in one basket and seek a supply from only one supplier?
Well, again, the contract will be reviewed at some point in the near future, and I think that this is something that we'll all have to discuss as a federal, provincial, territorial community. I mean, there are clearly going to be lessons learned from this, like there are with every health event.
But is that one of the lessons?
We'll be evaluating whether or not that was the best strategy and what the strategy might be as we move forward.
I see you're trying to play it kind of diplomatic here, but I mean, have you concluded in your own mind that it doesn't make sense to have sole sourcing going forward?
Well, I think that has to be thought through really carefully. There are advantages and disadvantages to multiple suppliers. One of the objectives that Canada wanted to achieve with our contract was having a domestic supply of vaccine in the event of a pandemic because of concerns related to things like embargoes of supply. And Canada is in a very fortunate position because we have a good supply of flu vaccine. We're going to have enough to immunize our entire population. We are probably one of the only countries in the world that is in the position to be able to do that. So, you know, clearly there are strengths and weaknesses related to multiple versus sole suppliers, and that will have to be factored through as we move forward with deciding how we're going to plan for the next pandemic. Okay.
Have you, Dr. King, heard of any examples of significant adverse reactions to those who have had the vaccine so far?
We haven't. We are actually tallying that right now. There have been in Ontario a little bit more than 50 reports of some sort of an adverse reaction following flu vaccine, and we're compiling that along with the federal government, but certainly nothing serious at all in terms of that has required, or certainly not resulting in death, or that has required a hospitalization. It may have required a health assessment, but not a hospitalization, and that would be very consistent with what we might see in a regular flu season. And the post-marketing surveillance, which was what you're talking about, the monitoring, was a very important part of the licensure of this vaccine, and we're monitoring that closely.
Was the vaccine tested enough before being rolled out?
Well, I think it's important to remember that fast track doesn't mean shortcut, and the vaccine was, the studies on the H1N1 flu vaccine were done in a limited number of people, but the various components were looked at in many others, with the H5N1 strain, which is the strain that we were concerned about there a year or two ago.
Avian.
the one that caused the avian flu, right, that in fact still is causing avian outbreaks in some parts of the world, and also the adjuvant as well was tested in over 45,000 people. And so, yes, the testing was done, it was reviewed, and every lot of vaccine that comes off the assembly line is also tested for quality before it's actually used in our communities. So the safety testing that is done by Health Canada is very rigorous, and we have one of the best regulatory systems in the world for our vaccines.
So how do you account for the stories we're seeing in some newspapers now that say that somehow, I know you say what was the line you used? Shortcut doesn't mean?
Fast track does not mean shortcut.
But this didn't go through all of the lengthy testing procedures with control groups and so on, I'm told from what I read, that other vaccines in the past have had. Is that accurate? Because we're reading that.
No, and in fact it's not in many ways, and I'll tell you why. Is there was a lot of preparatory work done with similar vaccines in order to prepare for a pandemic. There was a special regulatory process followed in order to prepare for a pandemic, and so that we could make a vaccine available in a shorter period of time when a pandemic hit. So all of that preparatory work was done, and as I said earlier, I do have a huge amount of faith in our regulatory authorities in this country.
SARS was 6.5 years ago. What were you doing 6.5 years ago?
I was managing SARS for the federal government.
There you go. So you would have been integrally involved in learning some of the lessons from that you no doubt are applying today. Like what?
Well, I think communication is very important, and consistency of communication is really key to try to ensure that the public gets clear messages, and there's been a huge amount of effort made at a federal, provincial, territorial level, and myself with the medical officers of health in this province to provide consistent messages in an environment where the science is emerging, the policies are being made, and the communication is being done sometimes in the same day, which poses challenges in and of itself, but communication is really fundamentally important.
Can I just understand what that means? Does that mean you people communicating with a single voice, or does that mean us getting it right when you say what you say?
What I'm saying is us speaking with a single voice, so that we come to consensus on what we need to be saying about the circumstance that we're in at the moment. And so there's a lot of discussion about what we do need to be telling the public among ourselves and with our colleagues at the provincial level as well. It's really important, especially when things are changing really rapidly, and to avoid mixing up messages to the public. It's really quite key, and it's very complex as well. I mean, when we're talking about adjuvanted vaccines and unadjuvanted vaccines and who gets what, and
pregnant women get the unadjuvanted, right?
That's right, yes, and we are getting some of that this week, and we're going to be rolling that out this week. But you know, this. And again, the science is coming in real time, and you know, it makes for the possibility of the public getting confused about issues. Okay, we got a couple of minutes left. Let me go through a few more things here. By when do you think everybody who wants to be immunized, and that won't be everybody, but everybody who wants it, by when do you think they'll get it? By the end of the year, the end of this year, end of December. If you looked at what we distributed to every house in the province of Ontario, we plan to deliver our H1N1 immunization program during the months of November and December, and we're on track to do that. We started a week early, but yeah. You did start a week early because, yeah, you got some supply early. Are we going to run out of the vaccine by the end of the week, though? Because I've been reading about that as well. Well, we have a limited supply right now, and we don't know right now how much we're going to get next week. So what we're doing is, in the health units that are running short, they think they're going to run out, we have a very small supply centrally, and we're backfilling that vaccine in those areas that are rapidly running out of supply, and we'll do that until we don't have any left. If you can't count on the supply, how do you know you'll get everybody vaccinated who wants to be vaccinated by the end of the year? Well, I think it's important to remember that this is still a ramp-up period for GSK. And GlaxoSmithKline. GlaxoSmithKline, correct, the producer, yeah, out of Saint-Foy, which is where our vaccine is made. And we are advised by the federal government that within weeks we will have millions of doses coming every week, and that we will have our supply by Christmas. So in keeping with that information that we have right now, we are ramping up to have all of our vaccine out into people's arms in those who want it by the end of December. And you're confident the supply will be there? Well, we are advised that the supply will be there, and we look forward to getting more information and
So you know what?
in a timely way from the federal government
I
on
hear
this.
you. I know you can't make guarantees, and I know nothing's for sure in this world, but when you say we're advised that, that's not the same as yes, right?
Well, we're told, and I have no reason to believe that we won't get the supply, and there has been a delay this week and a bit of a shortfall, but that doesn't mean we're not going to get it in the end, and I certainly trust that the federal government is going to supply the vaccine and GSK is going to supply the vaccine that we've been promised.
Okay. Dr. Arlene King, Medical Officer of Health for the Province of Ontario. Thanks for visiting us tonight at TVO.
You're very welcome.